I am here in Longworth building. None of my Republican colleagues are here. They have decided to stay home while 15 million Americans are at risk for losing their health insurance. And everyone's healthcare premiums are on the rise. So let's go talk to my friend, the Congresswoman from Virginia, Jen McClellan, about what's happening in her district. Come on. Hi, Congresswoman. It is so good to see you.
Thank you.
Thank you for meeting with us.
Absolutely.
We were in Longworth. We're glad to find a Democrat who's here at work because there aren't any Republicans. And I know that this healthcare crisis has really impacted your district, as we're seeing it, just reverberate around the country. Mm-hmm. But tell me a little bit what's going on. We've heard of hospital closures in Virginia. Mm-hmm. And what are you seeing?
We've had 3 rural providers close already, citing the big ugly bill and the cuts to Medicaid. I have visited with our healthcare safety nets. They are stretched to the breaking point and very worried about how they will continue serving patients, especially once the enhanced premiums tax credits go away and they will once again see more uninsured patients. I just visited one of the 6 hospitals that are on the list, put at risk by the big ugly bill, Southern Virginia Medical Center down in Emporia, which already is a healthcare desert, is a food desert, has high concentrations of poverty, and they're committed to keeping the doors open, but they worry about the impact that the Medicaid cuts will have on their ability to do that. And then I've talked to small business owners, farmers, self-employed people who are starting to get their notices saying that their ACA premiums are about to jump double at least. So a lot of people are very stressed.
I am worried, and I know you've done so much work around maternal health, and it's one of those lines of service that we see is the first to go when a hospital or a clinic needs to save money. What are you seeing around maternal health?
Well, a lot of people are worried. It's everything from the decimation of the federal workforce and the group in HHS that is actually collecting data around maternal and infant mortality and helping us identify the causes, to funding cuts for grants to help address those causes. And then so many people who are going to lose their health insurance, and that means they're not going to be able to afford contraception. They're not going to be able to afford prenatal care. As somebody who almost died in childbirth and now had to make a decision to either go on long-term contraception or risk dying, it's really, really scary. And all of the underlying health causes that make so many women at risk when they get pregnant are just going to get worse when they don't have health insurance.
Yeah, it's a funny thing when you take away preventative care. All the costs go up and the outcomes worsen.
And they go up for everybody because, again, even if you're uninsured, you're still going to get sick, but you're going to show up in the emergency room when it's a lot harder to treat, if it can be treated at all. It's not going to be compensated, and the rest of us will pay for it.
That's right. Everything the Republicans have done have made it harder and more expensive for people. Yeah. And we're so grateful to you, Jen, for your leadership and being a champion and showing up for the people of your district and this country who need to have their voices heard here in the Capitol.